Hello, my name is Brianna Adu. It's spelled Brianna, last name Adu. I'm a clinical nursing student, and today I'll be doing my final head-to-toe assessment assignment. So before we start, I'm just gonna scan the room. Alright, so perfect. So before I start, I'm just gonna perform my hand hygiene. I'm gonna clean my equipment, and then I'm gonna apply my gloves, and then I'm going to knock the door, provide privacy. Hello, my name is Brianna. I'm gonna be the student nurse today. I'm gonna be doing the head-to-toe assessment on you. Before we start, can I please confirm your date of birth and your name?
Yes, it's Will. I am born 1998.
All right, perfect. So before we start, are you comfortable?
Yes.
Do you feel safe?
Yes.
And do you need to use the bathroom at any time?
No.
All right, and is it fine that, can I get consent to touch you throughout the head-to-toe assessment today?
Yes.
Okay, perfect. So with what you've provided the information with, I'm just gonna ask you 10 questions prior. So where was the onset of the pain, like when you first fell?
In my wrist.
Okay, what was the pain scale out of 1 to 10?
A 6.
Do you have a history of falls?
No.
Did you take any type of medication?
No.
Did you apply any ice or anything to it right after it happened?
No.
Was anybody with you when you fell?
No.
What sparks the pain more? Like when you wake up, like when you're getting up, does it spark the pain more for you?
When I wake up.
Okay, is there any type of sensations that hurt a little bit or tingle a bit more?
No.
No? Okay, and what would you say you're feeling today? How are you feeling today?
I feel okay.
Okay, and when you fell, was there anybody to help you up?
No.
Okay, no problem. Thank you for answering. So we're gonna just go into the general survey now. So when I look at my patient, the skin color is appropriate to their ethnicity. They came into the hospital odorless. She's sitting upright. Posture is good. She looks nutritious, healthy. When I'm looking at her, her mood is calm. She's just normal, and she's been engaging in eye contact with me throughout this whole thing. So can I please just test your gait balance now? So just walk forward and back for me, please. All right, perfect. So her gait is good. Her record breathing also seems good. No signs of distress as well. Can you please name your name, the date, and where you are?
Yes. So my name is Will. It is Sunday, and we are at Seneca College.
Okay, so alert and oriented × 3. So before I start, I'm just gonna inspect and palpate your head. So when I'm inspecting and palpating the head, it does look cephalic to the head. There doesn't seem to be no lesions, no lumps. And when I'm palpating, do you feel any type of pain?
No.
All right, perfect. So next, I'm just gonna inspect and palpate your hair. So as I'm looking at her hair color is brown. There doesn't seem to be any infestations or any foreign bodies, and it's soft to touch. So that's good. So next, I'm just gonna be inspecting and palpating your facial. So when I touch it, it is warm to touch. There's no type of lesions, no type of scars, and there doesn't seem to be anything that's like any type of scars on her face. So next, I'm just gonna be doing your cranial nerve number 7. So can you please smile for me? Can you please show your teeth? Can you please frown? Can you please lift up your eyebrows? Close your eyes shut, and then puff out your cheeks. Okay, perfect. So it looks like her cranial nerve number 7 is intact. So next, we're gonna be moving on to eyes. So when I'm looking at her eyes, her lashes are equally distributed. Her eyebrows are equally distributed as well. Her eyelids look normal. They don't look swollen at all. Her sclera is white in color, which is normal. And can I just pull it down? Her conjunctiva is pink, which is also normal. And there doesn't seem to be any discharge, any crusting in the eye, so that's good. So next, we're just gonna be testing cranial nerve number 3. And I'm just gonna use this for 1 second. So when I'm looking at it, her eyes are symmetrical. Her it's round and it seems like it's a size 3. So now I'm just gonna do the test for your light reflex. So just okay, and now the other side. Okay, perfect. So when I did the light reflex, her eyes were able to constrict on the opposite side. So that's good. So next I'm just gonna do your accommodation. Just follow this pen. Perfect. And then next I'm gonna do your cardinal gaze. So just follow the pen. 1, 2, 3. 1, 2, 3. So her cardinal gaze is good as well. So that means her cranial nerve number 3 is intact. So next I'm gonna be doing her cranial nerve number 2, and that's gonna be her confrontation and her Snellen test. So her confrontation test, just let me know. So cover the same eye as me, like this. Actually, this side. And then just let me know when you see it.
I see it. I see it. I see it.
Okay, now the opposite eye.
I see it. I see it. I see it.
All right, perfect. And then next I'm gonna do the Snellen test. Just hold it for me and then put it at an arm's length. Read the bottom for me, please.
CFDHJ.
All right, perfect. So it does seem that our patient has 20/20 vision. So that means her cranial nerve number 2 is intact. So next I'm gonna move on to her ears. So when I'm looking at her ears, it does look symmetrical. There's no type of redness, there's no type of discharge of foreign bodies in her ears. When I'm palpating her ears, I'm gonna palpate her auricle. Do you feel any type of pain?
No.
What about your tragus?
No.
Alright, perfect. Not the other side. Auricle, pain,
No.
tragus, pain or tenderness.
No.
Alright, perfect. So now we're just going to do the otoscopic examination. You just hold the pinna up and back. Hold the pinna up and back. And I'm just gonna place the otoscope right here. So when I'm looking at her external auditory canal, there doesn't seem to be any foreign bodies, any discharge or anything. And then when I'm looking into her tympanic membrane, it does look pearly gray, and it seems to have no discharge as well. And then on the other side as well, on the external auditory canal, it doesn't have no discharge, no foreign bodies, and then the tympanic is pearly gray, no discharge as well. All right, so now I'm just gonna do the whisper test for you. So just let me know what you hear when I whisper it. So 1, 2, 3.
1, 2, 3.
4, 5, 6.
4, 5, 6.
All right, perfect. So her whisper test is good as well. So now I'm going to do the Weber test. So now I'm gonna do the Weber test on you. Just let me know if you feel it.
Yes.
On both sides?
Yes.
Okay, good. Now I'm gonna do the Rhine test on you. So I'm just gonna put it on your mastoid. Please turn your head a little bit. Tell me when you stop hearing it.
I stop hearing it.
No?
I stop hearing it.
Okay. Now on the other side.
I can't hear it. I stopped hearing it.
All right. So that means her Rhine test is good as well. So now we're going to move on to the nose. So the nose seems to be symmetrical and midline. There's no discharge or crusting. And then I'm gonna do the frontal sinuses. Press on it. Do you feel any pain, tenderness?
No.
Maxillary, any pain, tenderness?
No.
All right, perfect. So it's good for now. And then now I'm just gonna do her cranial nerve number 1 test. The patency, so close one nose, blow out, other nose, blow out. And then I'm just gonna get you to close your eyes. Close your eyes and close one nose. Tell me what you smell.
Coffee.
All right, next side.
Coffee.
All right, so that means her cranial nerve number 1 is intact. So now we're just gonna move on to her mouth. So her mouth does look pink and hydrated. Can you please open your mouth? And then your gums, sorry, can you please open your mouth? So then your gums look, doesn't look like it has any swelling, and it's pink as well. Your tongue is pink, it's hydrated as well. Your tonsils are intact, they're pink as well. And then your hard and soft palate is pink, and it doesn't seem to have any swelling. So that is good. Now I'm gonna test your cranial nerve number 9 and 10. So can you just say ah for me? All right, so can you just say it again? All right, perfect. So her cranial nerve number 9 and 10 is intact because when the uvula elevated when she said ah. So now I'm gonna test your cranial nerve number 12. So can you please lift your tongue and then go side to side? All right, and then can you say light, tight, dynamite?
Light, tight, dynamite.
All right, so cranial nerve number 12 is intact as well. So now we're just gonna move on to the neck. So I'm just gonna inspect and palpate it. Do you feel any type of pain when I'm touching it?
No.
So the color of her neck is appropriate for her ethnicity. There doesn't seem to be any lesions, any scars, any masses. So now I'm just gonna test your carotid arteries. So the pulse is strong, and the grade strength is 2+. And then after, I'm going to, after the carotid artery, I'm going to test your cranial nerve number 11. So I'm just gonna put resistance. Just press your head a bit. All right, and then the next side. All right, and then your shoulders as well. All right, so that means her cranial nerve number 1, her spinal accessory, is intact. So now we're gonna move on to her upper extremities. So when I'm looking at my patient, the skin color is appropriate for her ethnicity. She doesn't have no lesions, no scars, no masses or anything on her arms. When I'm palpating, there's no swelling, no edema, no lesions, no scars, and her temperature is warm, and there's no masses or anything. Then her fingernails are like pink, which is good. They're round. When I press down, her capillary refill is in 2 seconds, and she has no lesions, so that means her nails are good as well. So now I'm gonna test your range of motion. So you're gonna do flex and extension of your fingers, and then you're gonna do flex and extension of your wrist, and then after you're gonna do radial deviation, and then ulnar deviation, and then after you're gonna do flex and extension of your elbows as well, and then after you're gonna do supination and pronation, and after you're gonna shrug your shoulders, then you're gonna do abduction, adduction, and then internal rotation and then external rotation. When you did that, did you feel any type of pain at all?
No.
All right, perfect. So now we're just gonna move on to your radial pulse. So when I'm feeling it, she does have a good pulse, and her grade strength of the pulse is 2+. And then after that, I'm just gonna let you grab my fingers tightly. All right, so she does have a good grip, so that's intact as well. So now I'm gonna move on to her lower extremities. So when I'm inspecting her lower extremities, she does seem to have like a slim build, but it is muscular. Her skin color is appropriate for her ethnicity. She doesn't seem to have any type of lesions, any type of scars, any type of masses when I'm looking at it. So that's good. When I'm palpating now, do you feel any type of pain at all?
No.
She doesn't have any type of lesions, any type of masses, any type of scars, or anything that would hurt her. That would hurt her lower extremities. Sorry. Oops. Okay. So now I'm gonna test her dorsal pedis. Okay, so it's strong and it's a 2+ strength, and then her posterior tibias. Okay, so it's strong and it's a 2+ strength as well. And then after, I'm just gonna ask you to do your dorsiflex upwards towards you. And then your plantar flex, looking down. Good. So that seems good. So now I'm just gonna wash my hands quickly. And then I'm gonna move on to the lungs. So can you please turn your back towards me? And is it fine if I kind of like lift your shirt just a little bit?
Yes.
All right. So when I'm inspecting her posterior thorax, so it is appropriate to her skin color. There's no lesion, there's no masses, there's no scars. And it does seem like her back is normal, there's nothing wrong with it. When I'm inspecting it, do you feel any type of pain?
No.
There doesn't seem to be no swelling, no edema, no masses, no lesion, no scars when I'm touching it as well, and no skeletal deformities, which is good. So now I'm just gonna auscultate. So, actually no, I'm gonna auscultate. So breathe in really good for me. Another one. Just for the sake of the video, I'm just gonna go a bit quicker. So it does seem to be good. I don't see any normal findings. So I'm just gonna palpate her tactile 3 meters. So every time I press, just say 99 for me.
99, 99, 99, 99, 99.
And then after, I'm gonna test her symmetrical expansion. When I do this, just take a deep breath for me. Okay, good. And then I did also notice that her APT is a ratio of 1:2. And now I'm just gonna auscultate again for any sounds or anything, just to check again. All right, thank you. So I don't hear any type of wheezing. I don't hear any type of weird sounds. Her airway is clear, so she does seem good. And yeah, so now I'm just gonna check her anterior thorax. So can you please turn around for me? Okay, so it does seem as though her breathing is clear, and her rhythm is clear as well, and it's normal, and her breathing is normal as well. So now I'm going to move on to her cardiovascular, and then I'm just gonna locate her aortic. So her aortic, pulmonic, tricuspid, and her atrial. And then when I'm listening to it, when I'm auscultating it, I don't hear any weird sounds. It all sounds normal. And next, I'm just going to hear where I hear the S1 and 2 sounds best, and S2 sounds best. So it's around the second intercostal area, so that's where I usually hear it the best. And then I'm gonna test her atrial. So the rhythm is normal, so it's good. And then after, I'm gonna find where I find the S2, S3, and S4 sounds the best, which is usually more at the bottom. And that's good. I don't hear any type of murmurs or anything, so her heart sounds are perfect. So now I'm going to be moving on to the abdomen. The abdomen. So before I start, can you please lay on the table? And then I'm gonna make sure that my patient is draped properly. So when I'm inspecting my patient now, it does seem like her skin is appropriate for her ethnicity. There doesn't seem to be any lesions, any masses. Her umbilical cord is midline, and so everything is good. So now I'm just going to auscultate. Actually, I'm just gonna use my lifeline. 1 second. Yeah, I'm going to auscultate the 4 quadrants. So when I did this, I heard a high pitch and gurgling sounds. And now I'm just gonna auscultate her aortic, her left, right, iliac. All right, so when I heard this, I just heard regular gurgling. It wasn't anything that was abnormal, so that's good. So then now I'm going to percuss. Okay, so it does seem normal. There wasn't any weird sounds or anything, so it does seem normal. So now I'm just going to palpate her. So when I'm palpating, do you feel any type of tenderness, any weird feelings, pain? Okay, so I don't feel no pulsations. I don't feel any superficial masses, and I don't feel no rigidity, so that's good. So with her abdomen, we're all good with that. So next, we're lastly going to move on to the neuromuscular, and I'm going to be testing. Oh, you can get up for this one, the neuromuscular. So I'm going to be testing for sensations first. So I'm going to use a cotton ball to swipe. Actually, close your eyes. Tell me where you feel it.
On my leg.
Tell me where you feel it.
On my wrist.
All right, good. So then the next thing I'm gonna do is the sharp and the dull. So close your eyes. What kind of feeling do you feel?
Sharp.
What kind of feeling do you feel?
Sharp.
Again?
Dull.
Again?
Sharp.
All right, good. All right, and then the next I'm gonna do the sternocleidosis. So just put your hand out, close your hand. What do you feel in your hand?
A coin.
All right, perfect. And then lastly, for the sensations, just bring out your hand for me. Where do you feel the position I'm putting your finger?
Towards me.
All right, perfect. So her sensations are good. So next, I'm going to be checking her reflexes. So we're gonna do biceps first, triceps, and then brachiolates, and then patellar, Achilles, and then the dorsal, and then the plantar. All right, so everything seems all good. So lastly, we're gonna be checking the balance. So can you please stand up for me? So we're gonna be doing the Romberg test. So just stand still for me and close your eyes. All right, so her balance was good. That means her Romberg test is good. And then can you walk forward heel to toe and then backwards with your tippy toes? And then now with your heels. And then do the plantar. So close your eyes, stand still, hands out, and then the pointer drift. Okay, so she'll be able to stay still. But lastly, we have to do the abdomen one last time. 1 second. Lay down 1 second. And then fast. And then the Murphy test. Do you feel any type of pain?
No.
And then the Bloomberg test. Where do you feel the pain most? When I pressed it or when I let go?
When you let go, no pain.
Okay, then that's perfect. Then I'm all done my assessment. All right.